reflux is common. Actually, everyone has some element of reflux. The way that the barrier between the stomach and the swallowing tube works is it periodically relaxes in order to allow us to belch, to get rid of gas that digestion produces. So all of us have that relaxation. It's only when it occurs very frequently or there's a very strong change in the pressure difference where things get pushed back up that it becomes sometimes a problem. And that problem is associated with symptoms related to acid exposure of the swallowing tube. The swallowing tube is just not something that can tolerate exposure to acid. You can actually compare it to like a candle that's lit. If you put your hand close to it and move it over, it won't bother you, but you hold it there for a little longer and boy, all of a sudden it starts to burn. And repeated exposure to acid for longer periods of time, when we're laying down, that becomes a definite possibility. Can lead to pain, be it burning pain or even chest pain that resembles a heart attack. And some people have severe pain related to it. And then if there's more exposure, then injury can occur. So inflammation, damage, ulcers. After that happens, scar tissue can form and cause narrowing in the esophagus. Also the potential over a long period of time that some of the cells that are continually injured and then regenerate can become abnormal. And abnormal cells, or what we call Barrett's esophagus, has a small risk of progressing to cancer of the esophagus. Cancer of the esophagus, although uncommon, is actually rising in the community. So it's one of those problems that we think related to reflux is becoming more of a problem. We think reflux is probably becoming more common because of the obesity epidemic. So we'll see cases of esophageal cancer rising. Reflux treated typically very easily with acid-reducing medicines. You may have heard of PPIs, and those medicines suppress acid production in the stomach. And as a result, if there's less acid, then when reflux occurs, the fluid that comes up is less acidic and less damaging, less irritating. And most patients are cured with just a pill once a day. And they're very thankful for that.